Good day everyone, I am JC Jane Pabatang, a student nurse from Holy Name University. And for today's video is we're going to be doing an electrocardiogram. So what is electrocardiogram or ECG? So it is a simple test that is used to detect your heart's rhythm and electrical activity. So there are sensors that is attached to the patient's skin that are used to detect the heart's electrical activity every time it beats. So let's proceed on doing or performing the ECG. So the first thing you need to do is to verify the doctor's order for ECG in the patient's chart. Then after nimo na identify or na verify ang doctor's order is you need to establish rapport, introduce yourself to the client and identify the client using two identifiers by watching sa client's wristband or by asking the client his or her name. So good afternoon ma'am, I am JCJ Pabatang and I will be your student nurse for today. Please state your name ma'am. So after na nimo na identify ang client is proceed on providing privacy and explain the procedure to the client. So provide that privacy by napunan nato blanket ang client. And then explain the procedure to the client. So ma'am, we will be doing an electrocardiogram to you today. This test is used to detect your heart's electrical activity. So you don't need to worry because there will be no electrical current that will enter your body. This test will take about mga 5 minutes only. It can be repeated at a certain intervals. So after providing the clients the procedure or explaining the procedure is proceed on washing your hands. I have here. So after washing your hands, you can now place the ECG machine near to the bed of the patient. And you can now plug the cord into the wall outlet, and if it is battery operated, make sure that it is functioning well. And then turn on the machine and input the required client information. And if the client is already connected to a cardiac monitor, make sure or you can move the electrodes para ma-accommodate ang precordial leads. And then next is have the client lie in a supine position at the center of the bed with his arms on his side. And then you can also move the bed para makaprovide of comfort. And then expose the extremities of the client, of the patient, and then cover appropriately. And then next is the arms and legs should be relaxed para minimize ang muscle trembling that can cause electrical interference. If the bed is too narrow, place the arms or the hands of the patient under his buttocks to prevent muscle tension. And also, this technique is used to those who are shivering and trembling. And make sure the feet of the patient is not touching the bedboard. And then next is select flat and fleshy areas to place the limb lead electrode. Avoid muscular and bony areas. Also, if the client has an amputated limb, choose a site on a stump. And if an area is excessively hairy, clip it. And also, clean excess oil or other substances from the skin with soap and water to enhance electrode contact. Apply disposable electrodes to the client's wrist and to the medial aspects of the ankles. Apply the pre-gilled electrode directly to the prepared side as recommended by the manufacturer's instructions. Expose the client's chest and put a pre-gilled electrode at each electrode position. If your client is a woman, be sure to place the chest electrode below the breast tissue. And in a large-breasted woman, you may need to displace the breast tissue laterally. If electrode bulbs are used,
Then make sure to squeeze the bulb before attaching to the patient's chest. Connect the lead wires to the electrodes. The tip of each lead wire is lettered and color-coded for easy identification. The white wire goes to the right arm, the green one to the right leg, the red to the left leg, and the black one or the LA lead wire is to the left arm. And the brown or V1 to V6 lead wires are to the chest electrodes.
Then check in, see that the paper speed selector is set to standard 25 mm per second and that the machine is set to full voltage. The machine will record a normal standardization, mark A square, that is the height of the 2 large square or the 10 small squares na naa sa recording paper. And then ask the client to relax and breathe normally, and then tell the client to lie still and not to talk when you record the ECG. And then also press the auto start button and then observe the tracing quality of the machine and will record all the 12 leads automatically, recording 3 consecutive leads simultaneously. Some machines have a display screen so that you can preview the waveform, height extends beyond the paper when you record the ECG, and adjust the normal standardization to half standardization. And also, you have to note this adjustment on the ECG strip because this change will need to be considered in interpreting the result. So, when the machine finishes recording the 12 ECG leads and then ang result, you can now remove the electrodes and then clean the client's skin. So, mag-remove na ta. So after disconnecting the lead wires from the electrodes, dispose the electrodes, and if the bulbs are used, make sure to properly disinfect the bulbs and the clips. The next is assist the client in a comfortable position and make sure that the bed of the client is in a low position. And then remove any remaining materials or equipments, and then you can now wash your hands. And lastly, document in your notes the test dates and the time and the significant responses by the client. Verify the date, the time, the client's name, and the assigned ID number on the ECG itself. Note and appropriate clinical information on the ECG. So that's it for today. I hope you learned something, and God bless us all.